My daughter Jules, in about the first grade, was diagnosed with OCD and a major depressive disorder and separation anxiety. When Jules was first admitted, my husband and I were both scared. We were really, really scared. We didn't understand what was going on. We had the fear of the unknown of what it was going to be like on the unit, and we felt like we didn't have control over ourselves, our daughter, the situation, and that's really hard as parents.
The decision to have your child be hospitalized in a psychiatric unit is a very, very difficult one for most families. It usually happens at a point of significant crisis in the family, and that crisis actually can be an opportunity for change. That can be a time when the family and the child can really start moving on a new road and taking a new direction. We want to be there to help that happen.
We serve children and adolescents up to 18 years of age, and we serve them regardless of their diagnostic status or developmental level. We are located in a full-service hospital, and that gives us access to a range of services that other facilities may not have access to. We have a number of different multidisciplinary treatment teams that are comprised of psychiatrists and psychologists and mental health therapists, nursing staff, nutritionists, educators, the list goes on, and they all come together on a daily basis to talk about and plan the specifics of any child's care.
Our new unit was designed with the idea of providing lots of options for kids, living rooms, comfort rooms where kids could choose to go and get calm, or a living room where a family could sit and visit, a community space where all the kids could be together and share stories and games and activities. We set some pretty lofty goals to achieve around making sure that kids could heal in our setting, that we weren't secluding and restraining kids, and that families could feel like they were part of the process as opposed to people that were on the outside of a process that was happening to their child.
All our bedrooms are single rooms, and they all have an extra bed in there so that a parent or a caregiver can stay with a child or adolescent in the hospital overnight if they wish. Typical schedule in the day, we have our community meeting where the whole unit comes together to talk about the day, and then kids disperse into their age-appropriate groups. And throughout the day they have a number of therapeutic groups. Our focus there is really on trying to teach a range of emotion regulation skills, distress tolerance skills, and social problem solving skills. Children and adolescents also go to school. School is part of a natural day for any child or adolescent.
Kids present with lots of symptoms in mental health that sometimes can be really hard for everybody around them to be experiencing. And we really want to attempt to create an environment where there's an acceptance around those behaviors while at the same time a balance of keeping it safe.
Embedded in that is what we call a coaching model, where our specific focus is really continuous coaching with children and adolescents throughout the day.
You will find the coaches really working hard to help the patients and the families understand the behavior in order to figure out what skill is really going to help them cope with the emotion of the feeling they're experiencing. So coaches spend a lot of time learning how to sit with behavior in order to understand it before they choose an intervention. And then their next step in that is really helping families, including the patient, to start to understand that too. I think our unit is a place that kids can come when they are in a struggle that is not allowing them to live in their community setting safely. And they can come to our setting and we can provide that safety place for them to stabilize their behavior to get back home where we know they heal best.
When we did come and decided to just trust the staff and trust in what they they taught us, it really paid off. If I were to give a piece of advice to other parents that are going through this, I would suggest that they actively participate in everything that they have to offer here at Children's and outside. This is a good start to getting kids on the right path, but it's really a lifelong journey, and it's a family problem. It's not the patient's problem alone. It takes the entire family and ongoing counseling to get through these things.